Hi there, this is Marva Riley. Are you struggling with high blood pressure, uncontrolled high blood pressure, and have been taking blood pressure pills? Your doctor keeps raising the amount of blood pressure medicine that you're taking, and you're not getting the results that you want. Hypertension, chronic hypertension can lead to a whole lot of other health issues such as enlarged heart, cardiomyopathy, kidney disease, strokes, heart attacks, to name a few. My friend recently started having numbness in her arm and went to the emergency room. And when she went to the emergency room, her blood pressure was 197 over 98. That is so high that potentially she could have had a stroke or a heart attack. They went right to giving her blood pressure pills intravenously. And her report is that immediately she started feeling dizzy and lightheaded and nauseous and anxious and shaky, clearly having a reaction to the drug. Well, when she told them she was feeling nervous and her stomach wasn't feeling right, etc., they offered to give her another drug for the anxiety and another drug for the nausea and another drug for the headache she was having, etc. And they subsequently released her when her blood pressure was 175 over 95. According to her, she could barely find her way to her car. She got into her car. She didn't know she was not supposed to drive. She got on the highway, pulled over on the highway and just vomiting, sick, vomiting, headache, shaking, tremors, feeling nervous, anxious, vomiting more. She got back in her car, drove to her house, got into her garage, and just literally passed out in her car, in her garage. Didn't even know she was in her garage. Husband was knocking on the car window, trying to arouse her to get her out of the car. Got her out of the car, she fell out of the car, vomiting, etc. Clearly reacting to the drug that they had given her. When she got inside, they checked the blood pressure and it was indeed 190 something over 100 and something again. The pressure had gone up again. So she called me and she said, "What do you think I should do? I don't trust these doctors, etc." I said, "You know what? I know that sorrel tea is very good for blood pressure. Maybe you could try some of that." She said, "Oh, I have some because I saw that you had posted on your social media platform that sorrel is good for the blood pressure. So I have some and I'm sipping on some right now." So I said to her, "You could take it a little farther by making a cup of tea with the sorrel." I have sorrel tea bag. Well, actually, what I told her to do is boil like 3 cups of water, put a few cloves of garlic in it, bring it to a boil to make a tea, then strain it and put the sorrel tea bag in it and a teaspoon of cayenne pepper, mix it together and drink it as a tea. Now her report was that before she did that, her blood pressure was like 198 over 98. After she drank the garlic, sorrel and cayenne tea, the blood pressure, this top number, the systolic number, dropped to 165, and the bottom number, the diastolic number, was 90. Then she drank another cup of the tea about 2 to 3 hours later, and the systolic dropped from 165 to 144, and the bottom number, which is the diastolic, dropped to 88. So she was good. She went to sleep because the sorrel is a diuretic, so it kind of kept her up quite a bit during the night, peeing. But she said she realized that was a good thing. Okay. So the next morning she got up and she had another cup of tea with garlic, sorrel, and cayenne. And an hour after, she checked her blood pressure and it was 180 over 72. Now, I wish that she could have told the story herself because she would have told it even better. So you see, my friends, the drugs that these hospitals and doctors are giving to patients are killing them. Killing them. I recently read that heart disease is the #1 killer in the US. Cancer is #2, and medical treatments is the 3rd leading cause of death in the United States. And no wonder, because they gave my friend blood pressure pills that was killing her. She said when her husband read the side effects for the drug that they gave her, there were 15 side effects, and she was experiencing 14 out of the 15. And guess what? She said the 15th one could possibly cause death. And I bet if she had stayed at their hospital, she probably would have died. And when she had the reaction to the drug that they gave her, they didn't even think, well, maybe she had a reaction. She told them, my heart is racing. They said, let me give you anxiety drugs because you're anxious. It's a side effect from the drug, and they didn't pick that up. Fortunately for her, she was advocating for herself, and she refused to take any more drug and walked out of their hospital. Fortunately, she had me, her aunt, to call and say, what can I do? And I said to her, garlic needs to be one of your best friends going forward. Cayenne needs to be one of your best friends going forward. And sorrel needs to be one of your best friends going forward. And certainly you got to reduce that stress level because she's very stressed. And, she told me she's a little overweight. So you got to work on that, change your diet, start exercise, and take care of yourself. You got to put the oxygen mask on yourself before you can take care of anybody else, be it the children, the husband, the job, the mom, friends, whomever. You got to take care of yourself first. And one of the first things that you have to do to take the best care of yourself, to love yourself, is to put the right thing in your body. Healthy food. Got to decrease the stress level. Got to prioritize sleep. You got to exercise. You got to get outside and get some fresh air and put yourself first. Put the oxygen mask on yourself. So yes, I want to report to you, I have a cup of sorrel tea every day. It's kind of chilly right now. It's winter, between winter and spring. Today is like February 14, and it's a little chilly, so I'm outside. I'm going to do my exercise now. So I have a big mug of tea. It's not coffee. And here I have the sorrel, I have some ginger, and I have cayenne in this cup. Powerful medicinal food. This is what we call food pharmacy. We've got to live to eat. We've got to eat to live and not live to eat. We've got to take care of ourselves, and we've got to advocate for ourselves. This is Marva Riley, and thank you for watching.